Welcome back. I hope we've all had an opportunity to exercise our bodies, exercise our minds, and learn something new. Today we're going to be talking about all the different roles or titles that you'll hear from doctors in a medical setting. So whether you're going to get healthcare yourself, you have a friend ask you a question, you're watching a medical TV show, after this video you'll have all the information necessary to know who's who in the hospital. What is a doctor or physician? It's someone who's gone through 4 years of high school, 4 years of college, and then medical school to learn how to lead a healthcare team in taking care of and performing procedures on patients. Doctors can work in private practice settings in which they're working by themselves in an office, or in a larger group when it's them and a few other doctors in the same specialty, or they can work for large university hospital centers, and that's what we'll be talking today, where we have the complete hierarchy from medical student all the way up to attending. The lowest ranking member of a medical team is not even a doctor at all. It's your lovely medical students, which I used to be just a few weeks ago. One of their main responsibilities is to build a strong relationship with the patients they see. Because they see a much smaller volume of patients, they have the opportunity to gain real strong relationships with the patients they see. As annoying as medical students can be, they provide an amazing opportunity to make sure no information falls through the cracks. Medical students are working on turning their textbook knowledge into practical use where they can actually help patients. So a big thank you to everyone who's let medical students ever be a part of their care. After completing medical school, that former medical student is now a doctor. As they enter their first year of formal training as a doctor, they'll be referred to as interns. An intern is someone in their first year of residency, no matter what their specialty is. In the process of taking care of a patient, all the members of the medical team put their minds together and come up with a plan that they think will be best for that patient. It's the intern's job to put that plan into action. They're responsible for communicating with all the other members of the healthcare staff in the hospital to make sure that plan's in place. In addition, they're responsible for teaching those med students how to get ready to become interns. And by the end of intern year, an intern should have a good idea of how to create a plan for a patient depending on what their disease process is. They should know their way around the paperwork as well. One thing an intern can't do is practice on their own without the supervision of a residency training program. This is because they didn't finish taking all 3 steps of their board examination yet, because the 3rd step is not taking until your first year of residency. After interns finish up this first grueling year, they then officially become residents. As residents, they have a lot more responsibility in coming up with that plan for the patient. In addition, they're responsible for teaching interns, as well as communicating with both higher level doctors and the rest of the hospital staff. In surgical specialties, these residents will start to spend more time in the operating room and less time on the floor taking care of patients, though both still remain big responsibilities. Some of you may be familiar with the term chief resident. Now, chief resident, that title is kind of different depending on what institution you're a part of. At some institutions, chief resident is a very prestigious position that's nominated and voted upon. In some institutions, residents can volunteer to do an extra year to focus on administrative tasks and take that year as a chief resident year. The one commonality with all chief residents is that they're the most senior resident on the team, and the focus of their work duty starts to shift over between 100% clinical duties with patients and shifts over to some more administrative duties with paperwork. Whether or not a resident decides to become a chief resident, at the end of their residency, they're officially an attending doctor. They have passed their board examination in the specialty of their choice, and they're ready to practice on their own if they wanted to. However, many residents, after finishing their initial residency in the specialty of their choice, go on to a fellowship where they can subspecialize. Subspecializing allows you to become even more of an expert in an even more detailed field. And fellowships can go anywhere from 1 year to 5 years depending on the exact specialty that you're talking about. If and when a resident chooses to go on to fellowship, they now become a fellow. So they are a board certified doctor in the specialty of their residency and now are training again for a new subspecialty as a fellow. So sometimes people ask, well, who's higher in the hierarchy of the hospital between fellows who are going on to subspecialize and attendings who didn't do a fellowship but are still attending doctors? Now that just depends. I would say, if I had to give my own opinion, that however many years removed from your initial residency would kind of determine the hierarchy. The more training that person has versus the next person. Now, when we're all done with residency and all done with fellowship, we finally become an attending physician. An attending physician is the doctor in charge of the entire medical team. They're in charge of directing the residents, the interns, medical students, teaching all of them, making sure that the communication was done between the intern and the nurses they were supposed to talk to, and just making sure that the whole entire care of the patient patient is put together with a nice ribbon and bow. This is the same in surgical specialties as well. The attending has the final say in the plan of the procedure, as well as they are the final one that has to sign off after the procedure is over. That attending can choose to stay in a hospital teaching setting or go out into private practice or those bigger medical groups like we were talking about before. So I think that about sums up the entire totem pole of the medical trainees. I hope that next time your friends ask you or you watch a TV show, you know exactly what's going on. Next time you turn on The Resident or whatever show it may be, make sure you listen for those words: intern, resident, fellow, chief, consultant. Thank you for taking your time out of your day to watch this video. See you next time. Help patients and in the interns, and you have to be nominated